I'm excited to be here this evening to share with you some of the experience that we've had with this use of water-only fasting. We are defining water-only fasting as the complete abstinence from all substances except pure water in an environment of complete rest. It turns out that an important part of the benefit that occurs during fasting has to be associated with rest. If you allow an individual to be normally active during water-only fasting, the increased use for glucose increases gluconeogenesis, and it shifts the desired breakdown of fat into a less desirable breakdown of protein. So this rest is an important part as well as not eating. The fasting that we're doing ranges from 2 to 40 days. Average fasting clinically is 1 to 3 weeks. Sometimes patients, depending on the problems, may require multiple fasts. We're actually excited. We've recently acquired a Hologic DEXA scanner, which has allowed us to do very detailed and accurate whole body composition assessments during and after fasting. And as you can see from this graph here, what we found is that not only is fat preferentially mobilized during fast, and so what ends up happening, if you notice this graph here, fat, the black line, continues to reduce both during fasting and after fasting, during refeeding. The weight that's gained during realimentation is actually water, glycogen, and fiber, and not fat. So, you know, as I said, this demonstrated quite convincingly that the weight that's lost during fasting is, in fact, fat, and in particular, it's visceral fat, the fat that accumulates around the organs and abdominal area. We're in the process of starting a study actually looking at this in detail, body composition changes, but it is the first thing we've seen that really seems to preferentially focus on visceral fat. This brings up the next issue which I wanted to discuss, which is high blood pressure. This condition is so common now that a significant percentage of people, including younger people, are now being diagnosed with hypertension. And unfortunately, the medical management of hypertension says that you take drugs for the rest of your life. The guarantee is that you'll be sick forever and you'll never recover, because conventional medical treatment doesn't address the reason why people develop hypertension in the beginning. We've done a study. We took 174 consecutive patients with high blood pressure in a paper that was published in JNPT, and we were able to demonstrate the largest effects that have been shown in treating high blood pressure in humans. If you look at what used to be called stage 3 hypertension, where people's systolic blood pressure is 180 or higher, that average effect size was 60 points, as you can see from this graph. That doesn't even take into account the fact that these people started off medicated, they ended not medicated. So it's actually 60 points plus whatever effect the medication may have been having. And all 174 out of 174 people were able to lower their pressure enough to eliminate the need for medication. We later published a second study that looked at borderline hypertension, those patients that had blood pressure high enough to increase the risk of dying, but not high enough to justify medication. Medications are not routinely used with all patients that have moderate levels of hypertension because the risk of death and debility from treatment exceeds the benefit until your blood pressure rises to a certain level. That is, in fact, the definition of hypertension, the level at which blood pressure benefit from medication is exceeded by the cost and detriment to the body. And in this case, we had 68 patients with borderline hypertension, and the majority of those, all of those patients reduced their pressure 82%, actually below 120/80. And this was in fasts of 5 to 40 days. After we completed those studies, we were approached by the International Union of Operating Engineers, one of our California's more powerful labor unions, and invited us to present information on our approach, and ultimately they decided to support a study. We took the first 30 consecutive members of the union. They underwent an average of 3 weeks stay and lost 26 pounds, reduced their blood pressure 30/11. At 12-month follow-ups, they had maintained much of the results, and they reduced the cost of care to the union more in the first year than the entire cost of the program. And as a consequence, we went on for over a decade working with this particular labor union, treating over 100 of their patients with diabetes and hypertension with very significant and demonstrable results, both in terms of the clinical outcome and the savings to the union. So the question is it safe? Is it safe to take human beings in a medically supervised setting, put them on a long-term water-only fast? And so in order to answer that question, we did a study. And we took, the study ended up being, is fasting safe, a chart review of adverse events. And we published this 2018, looked at 1,100 patients that had undergone water-only fasting. The conclusions were that the majority of adverse events were mild to moderate. They were predictable, expected during fasting, that there was a correlation between aging and adverse events, but not severity, which was really the first time that was shown that older individuals, in other words, older than 65, could safely fast. And the conclusion was that the protocol that we're using at the True North Health Center was, in fact, safe. This publication of this first safety study on fasting has really opened up the use of fasting for anybody that needs to get through an IRB. The real question then is, okay, it's safe and it seems to work. How does it work? What's really going on? What are mechanisms that are occurring in this ancient practice? Well, one obviously is weight loss. Weight loss is a pound a day, and what we're shown now, as I previously showed on the slides, the majority of this weight actually is in fact fat and visceral fat. And we also notice there's a natriuretic effect in fasting, the selective elimination of sodium. This is a very powerful effect, much more powerful than what we find with, say, diuretics or hydrochlorothiazide and the like. You get a powerful diuretic effect, which drops the blood volume, which drops the blood pressure, allows non-healing wounds to heal, impacts symptoms of congestive heart failure, etc. The traditional justification of fasting was the idea of detoxification, the idea that people are toxic, that they have accumulated metabolic products inside their cells, things like PCB and dioxin and pesticides and residues. We know, in fact, that this is, in fact, true, because you can take a fat biopsy and break it down and find several hundred of these chemicals in various concentrations in people. And during fasting, these materials are rapidly mobilized and processed and eliminated, reducing total body loads during fasting, both of exogenous and endogenous toxins. Endogenous toxins being substances that, although may be detrimental, aren't traditionally toxic. They may be cholesterol or fatty materials that are normal materials but accumulated in abnormal quantity or in the wrong place, as occurs with visceral fat. Enzymes are induced during fasting both for macronutrient mobilization, things like gluconeogenesis, glycosylation, lipolysis. These are all induced during fasting, and they persist, it turns out, after fasting. So you are more efficient not only during fasting, but after fasting at mobilizing glycogen stores, fat stores, as well as gluconeogenesis in terms of protein mobilization. You also induce enzyme systems associated with detoxification, which is how those materials get out of the body, and we also believe that those detoxifying enzyme systems persist post-fasting, and they also seem to accumulate, so that every time somebody fasts, they get more and more efficient at it, just like every time somebody exercises, the glycogen mobilizing enzyme systems become better. That's part of what being a conditioned athlete is this repeated induction of these enzyme systems. Insulin, the hormone that drives sugar from the bloodstream into the cells, is profoundly impacted in fasting, and in fact that may be why about 80% of our type 2 diabetics are able to achieve normal blood sugar levels without medication. Now, granted, they have to continue to be willing to eat healthy and exercise in order to maintain the results, but nonetheless, it's a very rapid way of normalizing blood sugar levels and eliminating the need for people to use medication. The fasting mechanisms also include dealing with the gut, that tunnel that starts in your mouth and ends in your rectum. The microbiome, the 5 pounds of bacteria that live in your intestinal tract, are a very important part of your immune system. You know, 5 pounds of bacteria eating, drinking, and defecating inside you right now. What your bacteria defecate in you depends on what you feed them. And if you want them feeding you fertilizer like vitamin K rather than toxic waste like TMA, then what you need to do is feed your gut the food that they're designed to eat, which is soluble fiber, so your vegetables and sweet potatoes, not the animal foods that lead to increased production of TMA. The fasting affects the gut by affecting, we believe, this process of gut leakage. The gut has a membrane that filters out everything except very small molecules, much like this screen here would filter out the bugs. The problem is if the screen became damaged, the bugs could get through. If your intestinal mucosa membrane becomes damaged, you can leak material through gut leakage, proteins and other materials that shouldn't be there, and that in genetically vulnerable people, the immune system can react inappropriately and lead to autoimmune diseases and other problems. If you look here, the difference between one face and the other is what we call smoker's face. Smokers develop this premature aging because the free radicals from cigarettes actually cause collagen tissues to cross-link, and that's what wrinkles are. It's interesting, you know, some people claim that smoking actually in some senses protects you against things like lung cancer. And technically that's true. 80% of patients that smoke don't get lung cancer. But it's because they die of heart disease before they live long enough to grow their tumors. Because in addition to causing lung cancer, smoking causes the enamel lining of the vessels to be damaged, leading to heart attacks and strokes. So I guess theoretically, if people made smoking even more dangerous, maybe we could advertise it as cancer safe. I don't know. Fasting also normalizes the autonomic nervous system that balances the things you don't think about. Fasting also has a powerful psycho-spiritual effect. It's interesting, with all the different religions in the world, the Jews, the Jains, the Hindus, the Muslims, the Christians, even though they don't agree on many things, the one thing they do have in common is a tradition of fasting. This is an ancient practice that's recognized in most all of these traditional religions. And I think it's because it changes the way you feel and think about yourself and the world around you. Fasting enhances the immune system. It doesn't suppress the immune system. And in fact, this concept of autophagy, the idea of the body getting rid of cancer cells and getting rid of their unwanted debris, yielded a gentleman 2 years ago the Nobel Prize for his work on autophagy. And autophagy appears to be profoundly affected by fasting. Fasting also affects taste adaptation. Good foods don't taste good to people when they've been used to eating greasy, fatty, slimy, dead decaying flesh, highly processed, salty, sugary, fatty-induced foods. They become addicted to the artificial stimulation of dopamine in their brain from what we call the pleasure trap. And as a consequence, to get people to eat whole natural foods is undesirable. It takes a month on a low-sodium diet and maybe 3 months on a low-fat diet to really make that adaptation. But that adaptation can happen much more quickly with fasting, so that the end of fasting, good foods actually can begin to taste good, and therefore improving dietary compliance. We did a study on this adaptive stage. We were able to quantify minimum detection thresholds to salt, sweet foods, fatty foods, and what we were able to demonstrate was that there's a decreased liking of salty, fatty, and sweet fatty foods as a result of fasting. People actually have a change, a measurable change in their taste perceptions. Fasting, just in brief summary, decreases a bunch of things like glucose and insulin growth factor 1, which is associated with aging, leptin, which is associated with reduced inflammation. It reduces blood pressure and heart rate, and mammalian target of rapamycin, the mTOR, which is increasing autophagy. The microbial load, as I mentioned, is rebooted. That whole bacteria microbiome, the 1,000 strains of bacteria that are protecting us from things like viral diseases, etc. Inflammatory markers like IL-6, which is associated with the cytokine storm, which is associated with untoward impacts, is also reduced in fasting, as is objective measures of inflammation, the acute phase reactive proteins and other objective markers of oxidation inflammation. And fasting reduces abnormalities associated with metabolic syndrome. It's the most effective way of reversing metabolic syndrome that I've come across. Fasting increases things like adipectin, ghrelin, and things associated with satiety. It downregulates mechanisms that increase mitochondrial biogenesis. Beta-hydroxybutyrate, which is the main fuel you burn in fasting, is associated with increased BDNF, and BDNF is the chemical that's associated with protecting you against Alzheimer's disease. In rats that are given exercise ability or that are periodically fasted, they tend not to get Alzheimer's disease, and in part that may be because of the effect on BDNF. Fasting affects insulin sensitivity and cellular stress resistance and adaptation. That's talking about the idea that cancer cells don't like the fasting state, and healthy cells are protected in cancer, which is why we're going to show you a quote from Walter Longo, who mentions that there's a profound effect with the use of fasting on cancer, both in rats and now more recently in humans. And the gut microbiome and diversity is also profoundly affected by fasting. Walter Longo quotes quote in the Journal of Metabolism 2015 is that combination of fasting and chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone. And actually, when he published that, I think there was an attitude change about fasting because many of the pharmaceutical companies said, oh, we can get a better result with our traditional treatments by using this ancient practice of fasting. And at that point, I think fasting began to shift from being criminal quackery to cutting-edge research. I'd like to share, if I have some remaining moments, I'd like to share the results of one particular case report that we published in the British Medical Journal. This was a woman that had been tracked for 2 years with follicular lymphoma, a type of lymph cancer. It was stage 3. They had determined by the excisional biopsy. They had tracked the progression. They had assured her that diet didn't matter when she asked. They also told her that fasting was criminal quackery. Nonetheless, she decided, despite discouragement both from her family physician as well as the oncologist, to come to the center for medically supervised water-only fasting. We fasted her for 21 days, during which time her tumors disappeared. We could no longer feel these previously externally palpable tumors. She refed during the 21 days. She lost 22 pounds. At follow-up, although she still had some residual neutropenia, they could not find evidence of her tumors. By 6 months of a whole plant food SOS-free diet, her white counts had normalized. Her weight, you notice, continued to reduce. I explained to this patient that it was very important that she stuck to the whole plant food diet or it could be fatal because I'd track her down and kill her. But so she believed me because she stuck to the diet. At 12 months, we were able to do a follow-up CT scan that showed this shows the reduction during fasting of the tumor, a couple of her tumors before and after. On follow-up, we were able to do a whole body CT scan showing that, in fact, that she had maintained herself cancer-free. At that point, we wrote up this case report for BMJ. It was published. They said, listen, you need to do a follow-up, though, because some people spontaneously go into remission. And so we followed this patient for 3 years. She followed the dietary program. We got a follow-up CT, whole body CT at 3 years showing that she had maintained herself cancer-free. And they did eventually publish this paper as well as a follow-up. You know, she had maintained her weight loss through that 3 years, which shows not only can people get well, but it is possible, at least for highly motivated patients, to stick to a health-promoting whole plant food diet.